Well, according to a new Inspector General's report, and Chris referenced this, important security tests involving the Healthcare Information Hub is going to deal with Obamacare, actually months behind schedule, meaning a key determination about whether the technology that'll handle your personal information with Obamacare is going to be ready. Well, that determination is not going to come until 1 day before the start of the healthcare exchanges are set to begin. Let's talk about it with Republican Congresswoman Marsha Blackburn. Congresswoman, thank you for joining us today.
Oh, good to be with you, Shannon. Thanks for your attention to the issue.
Well, I got to ask you about this because there has been testing all along. There is a law that requires if you're going to have this kind of information out there, there have to be security plans in place for handling people's identity, their income. These are applications to tell whether they are going to qualify for Obamacare in the exchanges or not. And yet we hear the testing is weeks behind, and we may not know until the day before the exchanges start whether this technology is ready.
You're exactly right, and what a plan, right? We recently had a 3.5-hour hearing at the Energy and Commerce Committee that I chaired, and our single witness was Marilyn Tavenner, who is the head of CMS, Center for Medicare Medicaid Services, and in an exchange with Lee Terry, who is the chairman of our subcommittee on Commerce, Manufacturing, and Trade, I think she said some pretty revealing things. And when you look at it, this is what we're dealing with. They have a single source contract with United Healthcare and QSSI, one of their divisions, to implement this data hub, which she, interestingly enough, described as just a big router. But as they route this information and put it to HHS, IRS, DHS, all these different agencies that are going to look at your healthcare information, look at your income and your verification information, and by the way, they're going to contract with Equifax on verification of that income, then you have a lot of eyes that will be on your information. And you're right, they're saying, oh well, on 1 day before this goes into effect is when it's going to be ready for us to say it works or doesn't work.
And when it comes to personal information, income, identity, your medical conditions, those kinds of things, I would guess that most people would want to know that that's 100% fully verified and secure before they move forward. Now, let me ask you, there have been many delays through key parts of the law moving forward. You actually have a bill calling for delay, further delay. But my understanding is that your bill would push the delay for full implementation of the healthcare law until after the 2014 midterm elections. Do you think that's a plus or a minus? Do you want people to know the negative side of what they're getting into before they go to the ballot box?
I think everybody knows the negatives. And as you were just discussing with Chris, as this implodes, what we want the implosion to do is tilt toward the free market. We want our infrastructure still standing. And what you have those that have wanted that single-payer system, they want enough of it to be done away with that it would only go toward a single-payer system. We want to delay, defund, repeal, replace, and get rid of this. It is not ready for prime time. We have tried to talk to those that are standing up the data hub. They have referred us to HHS. They're not giving us the information. We have been working on this issue for a couple of years, and we're not going to let it go. We do not want them to win at this game and put us into single-payer health care. We want to preserve the infrastructure we have where patients are the center, not the federal government, but patients are the center of the health care system and are able to work with their physicians to meet the health care needs for themselves and their families.
All right, Congresswoman, we have to go. We're out of time, but I'm asking the same question I'm asking all lawmakers on today. Yes or no, are you going to have some August town halls?
Oh, absolutely. We've been out working all week, and what we hear from everybody, delay Obamacare, let's get it off the books, repeal it, replace it.
Well, we know constituents love the chance to speak to their elected officials, so we're glad to count you among those who are having meetings. Congresswoman, thank you very much.
Absolutely. Thank you, Shannon.